like with all videos, just stop it if you're interested and follow the links, and I hope you find it useful. I qualified in Cardiff as a dentist in 1982, and a couple of points there were, at that time, they started a nursing degree. There were 6 nurses training to get a Bachelor of Nursing degree. Now everyone needs one. All I remember were the nurses doing the course were brighter than me and a lot of the dentists I was on the course with. It seems now everyone needs a degree. And those with brilliant soft skills may not have the academic skills. The main thing about health is caring for people, and we really need to reward that. We didn't have computers, mobile phones back then, and when something went wrong or there's some decay, you took the whole filling out. That's what we were taught. And if you had problems with your gums, we cut the gums apart, called gingivectomies. We certainly don't do that anymore. But the health delivery system really hasn't changed between that of secondary and primary care. And so that's what this talk is about. Peter Drucker maintained that the NHS was the pride of Britain in the 60s, but towards the end of the 70s he said it was really more or less defunct and needed changing. So while we eventually got rid of British Leyland and British Steel and lots of other massive organisations, and they were changed or disruptive, as Clayton Christensen said, we've continued with the NHS. And the NHS was brought in at a time of when we had rickets, malnutrition and deprivation, and now it's the total opposite. The NHS is under more strain because of the total opposite. And the recent pandemic has actually been exacerbated by people's obesity and respiratory problems, and that's where dentistry has a big part to play. But there is no government funding to enable us to carry out prevention, but we may be able to take a bit of the money that's been sent to obesity. After all, obesity and dentistry have a common pathway which causes the disease, and that's the diet. But we should be using IT and using the cloud for diet histories. It will help with obesity, and it will also help with reducing dental decay. And as this person here says, the mouth is like the senator, or maybe the barometer of general health, and sugar really is an enemy, and those that lobby the government to make bigger profits. So please look through my app, and you'll see a lot of the comments that I'm making here and how I've addressed them in the app. While we know prevention is better than cure, we also know the government really don't pay for it, the press aren't keen on it, and neither are the public, to be fair. So we have to think of how we can change this around. To state the obvious, health and education are businesses. It's just often we don't view them that way. So maybe we need to think slightly differently about what we're trying to achieve as society. The high streets now have lots of space, and this is my idea. Teledentistry is a recent term, and you have to look to see what's happening in the States to understand how this will work. The idea for dentistry, as many people are scared of seeing the dentist, is to have a unit that only provides cleaning, so it'd be a hygienist unit. But in the hygienist unit, they'll be able to use the digital tools that are available at the moment, and they're advancing so rapidly that they will become diagnostic tools. But why stop there? There are lots of different new technologies becoming available and becoming down and reducing in price. All we need is a minimum amount of training to actually enable people to check their health. We could have dietitians, physios, chiropodists, all manner of other disciplines, but in a non-threatening environment. And many healthcare professionals from all aspects of healthcare who have retired often want to give something back, and it's feasible that these people could be employed in a similar manner to as in the charity shops. But at the same time, we could have the younger members who are struggling to get jobs to learn almost on an apprenticeship basis, which is probably better than becoming a student and the debt that incurs at a time when you're really not quite sure what you want to do. You may see if they have the soft skills that are necessary in order to deal with the public in general that a lot of very bright academics lack. But it'd have to be set up in a manner that engages the public, and that's where the difficulty lies. So we really need, while rewards work, sometimes what you want to do is to do something where they think, FEMO, fear of missing out. And this has worked in other countries in the past in a variety of ways. And with a bit of creative thinking, we may be able to embrace businesses and offer vouchers that if people attend, they get the voucher, and if they don't, they won't. So you could have cinemas where they'd offer them tickets for quieter periods of the day, and knowing that when the client comes in, they're bound to spend some money in the cinema. And you could have the same for gym vouchers at quiet times for gyms, may encourage people to go. Or you can have discount vouchers for retail, whereby that encourages people to actually go in and spend their money in a shop. There are lots of ways that if we just think slightly outside the box. My own experience of being vaccinated and my brother's inability to have an operation for the last 5 months as he's been in atrial fibrillation because his consultant has been working on the COVID ward actually highlights the problem. It seems likely we're going to have more periods of being vaccinated, and these units on the high street may well be a place to do them. With minimal training, we can give people the skills to give a vaccine. And so whilst it's great that the number of deaths from COVID have gone down, we also know the number of deaths from other diseases that would have been treated has gone up, and we would love not to be in that situation again. And it's ironic, the billions of pounds that we've spent on IT in the past with the health service on defunct systems, and also the track and trace that clearly hasn't worked. It would be nice just to have a little bit of money for something that does work, which is my app. It just needs to be advertised. Losing a tooth isn't fatal, but late diagnosis for oral cancer or having poor outcomes from respiratory problems because your oral health is poor and you have periodontal disease is the reality. And my app helps with this, which is why I say, save a life, share teeth for life. Please share it.
The British Health Service 15 years ago, everybody was told we have to emulate it. And the English themselves were almost sinfully proud of it. And any suggestion let's improve it was scornfully turned down. And today it's hanging on for dear life with people on waiting lists for elective surgery for up to 3 or 5 years, with nurses on strike and desperately unhappy with the number of young women going to nursing training down 80%.